takes place have a genetic nature because the chromosomal numbers or structural abnormalities are there. And 1 in 300 births which are there have a genetic disorder. Now this can, to a large extent, can be picked up by the screening method, which is done between 11 to 13 and a half weeks. Now here what is done? Here an ultrasound is done which is called an anti-scan. This is a specialized ultrasound which is now routinely offered to all ladies in Delhi who are pregnant. And after the ultrasound is done and the maturity assessed that it falls between 11 to 13.4 days, then the blood test is done. The blood test is dual test. Now when these ultrasound findings and this dual test biochemical markers are put in a computer, you will get a score. It says that it is a low risk case. Low risk case means that low risk does not mean that there is no risk. Low risk only means that the chances are very low, but nobody can take a guarantee that no case will happen. Now, 1 in 10 patients who are screened, we find it comes into high risk category. It means this screening test has to be confirmed to find out whether this baby really has congenital chromosomal abnormalities. Now we have two options. We can do an amniocentesis, which is done around 15 to 17 weeks. It is ultrasound guided, aspiration of the amniotic fluid, and that is tested. Culture is done, and there is another rapid test is also done. Rapid test is available in 24 hours, which has an accuracy of 99%, but the culture is 100%, is diagnostic. Now a non-invasive test can also be done at this particular time. Like many patients who are very precious pregnancy, say after an IVF pregnancy, and people do not want to go for an invasive test where the needle has to be put inside the uterus and to take out the fluid around the baby. Those people can have what we call non-invasive testing. Here the principle is that the fetal cells circulate in mother cells. So the mother blood is withdrawn and these fetal cells are examined in detail to find out what is the chromosomal abnormalities in such cases. The accuracy of this particular test is 99%. Very accurate. Though this particular test is expensive in comparison to the anti-scan plus dual test, but because the accuracy is 99%, many patients of high-risk pregnancy come forward for it. Thank you very much for listening this. Whosoever is pregnant must get these abnormalities because to find out the baby who's mentally retarded, there are specific chromosomal abnormalities. This can be very well detected nowadays and with fairly good accuracy. Thank you very much for listening us.